Hello and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of the show, so let's get started. We have one woman who's wondering if there are breathing exercises you can do instead of using CPAP. I can't wear a CPAP on with my medical condition. So breathing exercises, I'd heard about the playing the didgeridoo and the double-reeded instruments because it makes the tongue stronger. Is there a tongue exercise or some kind of exercise that would, do you know of it?
I don't know of any.
There's not in the standard literature then?
Not that I have explored. The mandibular advancement devices are okay for moderate.
They push the tongue
mild.
or the jaw forward.
They push the jaw forward, so that brings the tongue out of the way of the airway in the back, and that can help.
The hypoglossal nerve stimulator.
The hypoglossal, yeah. Then there's a nerve stimulator that can also help with mild to moderate sleep apnea, and but as far as exercises, it's hard to voluntarily strengthen the pharyngeal muscles, in the back.
They're really not muscles back. Well, there are muscles, but
but they're very involuntary in many ways. And so focusing on strength, moving the arm I can do, but moving the soft palate is hard to think about doing. So.
Yeah. What about exercise in general? Runners or people who are walking regularly, does that help sleep apnea or lung disease?
Well, it helps lung disease, yeah, for sure, and it actually helps sleep quality. And so I think being, regular physical activity, whatever you can do, is going to have a positive impact on sleep apnea, all those things. And so that's always the right answer, is to be active and exercise.
Good man, Travis. You're a man after my own heart. I have pulmonary hypertension and sleep apnea. I have trouble using my CPAP because I experience so much gas from the machine. I've heard that.
Yeah.
My sleep is not improved by the machine. I've been told I need to do a third sleep study. Is this necessary?
Yeah, that's aerophagia. That can happen.
You swallow air when you have the CPAP machine. Yeah.
That can be hard. Usually, sometimes it'll go away. It can be hard to treat. Sometimes you'll use a gas medicine, but that doesn't always obviously help. Might help with some discomfort with the surface tension of the gas, but it won't prevent it. And so trying different masks, maybe sleeping more upright, changing your position, or adding an oral device might help as well.
So people do better if you raise their head a bit?
Mm-hmm. Yep. So you kind of take gravity off of that, that posterior oropharynx there. That's tough. When the aerophagia is bad, it can be somewhat difficult.
So they're swallowing gas and it goes through the GI tract and then you pass gas rectally.
Yeah.
I think peppermint, alcohol, and chocolate all weaken the sphincter of the esophagus. And so if you drink alcohol before bed or peppermint gum, you're chewing gum for breath or just like peppermint, that might lead to more aerophagia. So avoid those substances if you're having that problem too.
Okay. Although I've seen them prescribed for people who have esophageal problems.
Well, sure. Kind of helps with saliva and coating the esophagus. So.
An Aberdeen woman says her husband was diagnosed with COPD and has a CPAP machine. He uses an inhaler in the morning and evening, but experiences congestion and phlegm later on. Is this normal with an inhaler use combined with other diagnoses?
Yeah, so phlegm is associated. That'd be more the chronic bronchitis type of COPD. There are other medicines, pills and inhalers that can sometimes help those, help that problem.
She was thinking that the inhaler brought on the phlegm, but it's helping opening it up and getting rid of the phlegm, which is a problem.
Yeah. So on the label as a side effect, most inhalers will say, problems that are associated with phlegm, but really what it is, there's you have this chronic inflammatory lung disease. There's goblet cells and other cells in the lungs and the airways that'll make extra mucus, and that the inhaler will help you open up the airways and get rid of that mucus.
And you want to get rid of that.
You want to get rid of it, yeah. So,
a viewer wonders what you think about oxazepam.
Oxazepam. Well, it's I think it's a benzodiazepine.
Yes, it's a benzo.
It's a newer one. I'm not familiar with it. I don't use a lot of benzodiazepines, because of the reasons we talked about during the show. A lot of these medications are variants of the same structure and have a lot of the same side effects. And
It's Valium with a different name.
yep, essentially. And so it has a little bit of a different elimination profile, so the body probably processes it a little different. And so shorter benzodiazepines are probably better for sleep onset. But like I said, I try to avoid them if possible.
Okay. I haven't been able to sleep since I took Chantix to quit smoking over 10 years ago. What can I do to be able to sleep a full 8 hours, please? I'm a patient of Dr. Hanson's.
Oh, uh-oh.
So Chantix. So a person's not smoking and hasn't been able to sleep well over the last 10 years.
Well, we should talk about that in clinic then. I don't know
Yes.
what, yeah. So it depends on what the sleep pattern is. Is it falling asleep but then waking up and not being able to go back to sleep? Is it just not being able to get to sleep? And so then we talk about sleep hygiene or treating other things. So other medical problems, so thyroid disease, depression, anxiety, all those things can affect the sleep. With insomnia in general, we try to do sleep hygiene.
And a good sleep hygiene would be cooler bedroom, no TV,
no pets laying on top of you.
no kids screaming.
Don't eat in the bedroom. Just use it for sleep.
Go to bed at a regular time.
Every day, weekend and weekday, the same time.
No phones in bed either. That's a common problem these days.
Yeah, that blue light will affect the sleep, and so those are some things. Now, what else can you do in that for the Chantix? Chantix, I'm not sure if that's.
I think she quit smoking, and I don't think she's on Chantix right now.
Okay.
Or is she?
Well, no. It sounds like it was 10 years prior.
So is it? She was able to sleep when she was smoking, and is less able to sleep now. I
In
worry.
general, nicotine disrupts sleep, and it changes the architecture of the sleep stages, and so maybe. Sometimes it's sleep stage imperception or misperception, where they feel like they don't sleep well, but when we actually do a sleep study, they look really good.
Do well. Dollars to Donuts. The cigarettes was a self-treatment for some kind of mood disorder, and that if you put her on a antidepressant of some kind, she would have better sleep.
Maybe, yeah.
I treated a ton of sleep disorder with antidepressants. It took about 3-4 weeks to get them there, but I always started antidepressants. I did not use Ambien. I went with,
treat the underlying cause, not just the Band-Aid. Yeah.
For the majority of time, people who have sleep insomnia often have depression, underlying
or anxiety, and part of that depression.
Yeah. We have one last question. A Hot Springs woman asks, what is bronchiectasis and how severe can it get, and what can you do for it? Travis, that's yours.
Yep, so that's non-tapering airways. So the airways are damaged for whatever reason, and instead of tapering down nicely, they stay kind of wide going all the way out. Because of that, the little fine hairs of cilia that beat don't bring the mucus to the middle to cough out, so you get mucus kind of pooling in those areas, higher risk for pneumonia and infection, and a lot of things can cause it. So if you have any immune deficiencies, that can play a role. Cystic fibrosis is probably the most common cause, or not common, but that's a well-known cause of it. And sometimes we don't know. If we don't know, we call it non-CF bronchiectasis. Treatment is airway clearance. We can't really fix it or cure it, so you want to keep the airways clear, so you can do an a cappella valve where you blow into a little flutter valve and it sends vibrations down that helps you cough things out. Sometimes there's drugs chest physiotherapy or a vest at home. Regular physical activity actually is important. Even in cystic fibrosis, when they're admitted to the hospital, we actually bring an exercise bike in the room to exercise because it helps cough things out. And then if it flares up, you'll need antibiotics and things like that. Now, there is an antibiotic that we'll use sometimes, maybe every other day or so, to help suppress exacerbations if there's a lot of them. And then medicines that thin the mucus so it's easier to cough out. But the treatment is airway clearance and get that stuff out.
Okay, so wonderful story and explanation, bronchiectasis. I'm going to ask one more question of you. Mm-hmm. Any particular take-home message you want people to remember?
Well, with CPAP being so common with obstructive sleep apnea being so common and dangerous, and the poor compliance that we've seen, historically, I think just remember to approach it, with the many different people to figure out what's the trouble you're having with compliance and using it, whether it's the medical equipment supply company or your physician or even your spouse that might give you some insight on what's going on and what the trouble is.
Don't give up.
Don't give up.
Take home, that'd be your same take.
I think that's great, and to remember that it won't hurt you. In general, the CPAP won't hurt, and it can only benefit you. And not very many things in medicine are that way, where it can be such a huge benefit with that low of a risk. And so just encourage people to wear it and to try. Don't give up. Whether it's your doctor, really the home medical companies are our biggest ally because they have all the different supplies and the things and the knowledge to help get used to the mask.
I like the idea of just wearing it in the last 3 hours of wakefulness so you can get used to the
Oh yeah, yeah.
Well, thank you for joining us on our Facebook page. We appreciate all of your questions, the opportunity to answer them. So until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.